first question that has been sent in. What should a person be doing before they get vaccinated?
I think before they get vaccinated, there's nothing special to be done. You have, depending on the time of the day that you have the appointment, you have your food, you be hydrated well. And if you don't have any immunosuppression or any chronic disease, then you can straight away go and get your jab. Uh, no special, requirement. In case you have a chronic disease or you're on some long-term medication, you have a history of cancer or any other serious ailment, then you need to discuss it with your doctor. Let him know that you're going for the jab. And in most instances, you will still be able to go and get the jab. So, frankly, you don't need any blood tests or anything like that before you get your jab.
Okay, that's wonderful advice for people who are asking about the anxiety that they are facing about it. I also want to ask Dr. Arvinder Singh Soin another question that's coming in. What are the do's and don'ts that people need to do before they get the second jab, and also what medication should be avoided ahead of the vaccination?
So, just as in the time that you're getting the first jab, even for the second jab, there's nothing specific to be done, except you have to make sure that you don't have symptoms like cough, fever, something that might suggest the COVID infection itself, because you should not be getting vaccinated if you have COVID infection. So if you have symptoms that suggest COVID, then you should hold on. You should get your COVID test done. And only after 2 to 4 weeks of complete recovery from COVID should you actually have the second jab. It depends on how severe the COVID is. If it has been mild, then waiting 15 days is okay. But it's been moderate to severe, then you have to wait a month after you've recovered from COVID. That's the first thing. The second thing is that once you've had the first vaccine, a lot of people have been asking me, can they actually have a different vaccine? For example, somebody's had Covaxin and now they're not getting that, and can they have Covishield? The answer is no. You have to have the same vaccine, 2 doses of the same vaccine. If it's been Covishield, then you can space it by 6 to 12 weeks. But if it is Covaxin, ideally you should be having it after a month of the first dose.
All right, that's very, very crucial, and that is something that people who've been asking should remember. If you go in for the first vaccine, the second has to be by the same company. It has to be the same vaccine, like Dr. Soin is saying. A little later, I'm going to be asking you about your latest tweet also, Dr. Soin, where you've written that the vaccination drive needs to be galvanized even further. Dr. Chaturvedi, I ask you another question that's been coming in from people. Is there a category of people for whom the vaccination is not recommended?
Actually, most of the people ask what we call it the medical contraindication. So I always tell people that there is only one situation where vaccination. Otherwise, every day we get hundreds of calls that I have diabetes, I am obese, I have cancer, I have renal failure, I have rheumatoid arthritis, whether I should take vaccine or I should not take vaccine. So in that situation, the answer to all these questions are only one answer, that anybody can take vaccine except in one condition, if you are allergic to vaccine. So that is one thing that you can take in every situation. As on today, the pregnant women and children, they are not, but there is a study has already been done in the US and Canada that it can be done, it can be given for, as on today in our country, except in these conditions when somebody is allergic to vaccine, even that there also, nobody knows if you are allergic to one vaccine, you will be allergic to another vaccine. So that's why they made you sit for half an hour. Whether you are anybody, you are made to sit for half an hour and they see for the reaction. Even if there is some reaction, it's an antigen. Look, history of vaccination is very old in this country. Almost 30 crore children are given vaccines every year. So we are quite well prepared for a vaccination program. Even small children tolerate very well. Probably when the vaccination starts And when we started vaccination program for this COVID, and a lot of political statements came from people who were not unscientific. They were not scientific people, and they were naturally issuing non-scientific statements. So people were scared. Otherwise, vaccines are very, very safe. Look, I was in army before this. This is one organization where 100% vaccination has been done. That's why there is not a single fatality in army. So vaccine is so effective. And if somebody wants to know in this country, there is a living example that whole Indian army, serving army, has been vaccinated. There is not a single fatality, and we have in Indian army hardly 50-60 cases. So first thing, it is effective, and secondly, it is safe.
Yes, most definitely, most definitely. Therefore, everyone, even people who feel that they could be allergic, have to go in for the vaccine. As we've been saying consistently on Republic TV viewers, the way to move forward and to fight the COVID-19 battle is through vaccines. I also want to go across to Dr. Wali, who's also joining us here. Dr. Wali, what about pregnant and lactating women? Several people say that when they are pregnant, they should go in for the vaccine, they should not. What is the advice for such women who are asking this question?
Can you please repeat? Is it about pregnant women?
That's right, sir. I asked about, people are asking, pregnant women, lactating women are asking whether they can go in for the vaccine also.
No, this is a phase which is temporary. After they deliver and they start nurturing their babies, within 3 months of finishing pregnancy, they should avoid. After that, they should go in. And that too under medical supervision. You know, we do not want to risk the child. We do not want to risk a pregnant mother. And that is how the policy is being done, because no trials, no studies have been done on pregnant women. Similarly, on very small children, studies are being conducted, and we are waiting for the trial results. And in our country also, we will start vaccinating very young children. So far, we have gone up to 18 plus, but there are efforts between 12 and 18 years that how soon we can encompass them in the vaccination program and also increase the numbers. There is a lot of great risk as vis-a-vis third wave is talked, and we have to be prepared for the third wave. And as the scientific advisor to the Honorable Prime Minister, Mr. Dr. Raghavan, has said already, the whole country is moved by his suggestion to take precautions for the young children and also for younger adults so that we face third wave in an appropriate manner. And I pray God with all the good things to occur and third wave may not come, but we are even talking of fourth wave. So in all this, we have to be very, very scientific. And as the question is, yes, we have no data on the pregnant ladies. So pregnant ladies should wait. And I would tell you one good thing is that during pregnancy, a lady goes in the unprecedented stress. So in this stressful situation, when the lady is also labile, so we don't attempt for vaccination because she is already going through several changes in her body. Let it be hormonal, let it be water overload, let it be circulatory overload, and let it be blood-related overload. So everything combined, we have to wait during pregnancy and avoid vaccination. No, it is the one absolute contraindication.
All right, sir. That's important for all the pregnant ladies or the lactating women, that you should be waiting for the time being, and once this period is complete, after 3 months after that, they can go in for vaccination. I also want to introduce my guest, Dr. Jayant Barve, who's joining us, Senior Consultant of Gastroenterology and GI Endoscopy at Nanavati and Leelavati Hospital in Mumbai. Dr. Barve, a lot of people are also asking us, can painkillers be taken to numb the soreness in the arm post-vaccination?
Yeah, see, the common side effects of vaccination are, one is local and some are systematic. The local side effects may be almost maybe 8 to 10%, and that you get is local soreness there, pain there, at times mild bruising there, at times redness there, which can be very easily treated with the normal painkiller paracetamol. You don't need anything strong like ibuprofen or one of the drugs which are called as NSAIDs. Taking a simple paracetamol is good enough to take care of not only the pain, but some patients who have got good immunity also may get fever, body ache, joint pain. So all this can be taken care of paracetamol 2 or 3 tablets per day for maybe a day or two. That should suffice. At times you may apply little ice compresses, but I don't think really it is to be bothered too much about. Just paracetamol is fine. Can I add something for pregnancy?
Okay.
Hello?
Please, sir. Please do.
Yeah.
Go ahead, sir.
See, there has been, as earlier speaker has mentioned, there has been no experience or no studies done for pregnancy here. One thing one must remember that during pregnancy, if the COVID happens, chances of COVID becoming severe and needing hospitalization are supposed to be more. So they are really a high risk population which is at the risk of getting a severe COVID if they get COVID. So that one thing is to remember. Second thing is there are a lot of healthcare workers, who are females, who are young, and who are probably in the age group of childbearing. And they also are at a high risk of getting COVID because they are exposed to COVID all the time. So the risk to the pregnant mother depends upon what state of society she is coming from, what job she is doing, and what is the prevalence of COVID in that particular community which she is working. In fact, the Federation of Obstetric and Gynecology Society India, they had earlier said that yes, pregnancy is not a contraindication. mRNA vaccine, which is used in USA, they clearly say that pregnancy or lactation is not a problem for giving vaccination. But as on today, the way I understand, day before yesterday only, there was a directive from the Director of Child and Maternity Welfare from India. They said that no vaccination for pregnancy and during breastfeeding. But maybe after doing some studies, we would like to revise this strategy. The experience in USA is of a different type of vaccine. We don't have any experience so far as the Covaxin or Covishield is concerned. That may be one of the hindrances. But the Obstetrician Society earlier stated it can be given. But now looking at the government directives, they have decided not to advise vaccination for a pregnant lady or breastfeeding lady.
All right, very, very crucial, Dr. Balve. That is something we have to look at. I also want to ask Dr. Harsh Mahajan. Dr. Mahajan, several people are asking what is the ideal time period for a COVID patient to get vaccinated post-recovery?
See, post-recovery, the ideal period, and this is, from the US CDC, they say that do it after 90 days of recovery from the COVID. So whether you've not had any jab and you get infection and after that you need the vaccine, 90 days for your first jab, and suppose you had a jab and despite that you got COVID and now you're waiting for your second jab, again, the recommendation is 90 days after recovery. The reason behind this that is given is that for these 3 months, at the very least, there is robust antibody response in the body. And so you should not get it or do not need it during this time. And 90 days you wait and then get your jab.
Okay, so that's crucial. That's extremely crucial. So 90-day period is crucial for someone who's had COVID and then they're going to recover, after which the jab should be there. Extremely crucial. Dr. Soin, therefore, another question that's being asked is when can a person get vaccinated post-plasma therapy?
So, plasma therapy is linked to recovery from COVID. And although I understand that the CDC has that recommendation, but please remember they have recommendation based on mRNA vaccines, which we don't have in India. So after plasma therapy, one assumes that maybe the patient will recover to normalcy in about 2 to 3 weeks. And after one recovers to normalcy, a period of a month is what they say in India. But yes, CDC data is based on mRNA vaccines. So perhaps that cannot be directly extrapolated to India. But here, a month after recovery, and plasma therapy is only in the middle of the treatment for COVID infection. So once the complete recovery has happened, you wait for a month, then you get the second jab or the first jab if you haven't had it.
Okay. Now, my next question then, what should be the post-vaccination steps that need to be taken? I asked Dr. Chaturvedi that, Dr. Chaturvedi, what are the post-vaccination steps, the do's and the don'ts that people need to keep in mind, other than, of course, the appropriate COVID behavior that needs to continuously be kept in mind?
I think once you get a vaccine, you get a really, that you
have that feeling of relief. I can tell you my own feeling, though as a doctor, I must tell you that first thing is the moment somebody takes a vaccine, first thing he was convinced in the beginning only that it does protect. Yes, as you said yourself, that all those protective measures, whether you have mask and everything, should.
In any case, first
we brief that you wait for half an hour so that he is rest assured, because a lot of people are very apprehensive. They ask, Doctor Saab, will I get a reaction? Or if I go to home, I'll get a reaction. So we always say, okay, you wait for half an hour here. And in any case, the long-term issues are not much, as our previous speakers also told, that you might have some swelling. Like I had when I had a vaccine, I had little fever or headache, but that goes away in 24 hours, even if you don't take anything. But we do advise people that you have your paracetamol or something with you. If you have some issues, then you can take. A lot of people ask whether I can take bath. Yes, you can take bath. Whether I should use mask or double mask. As I said, you do what you were doing earlier, and you note down. You keep that your card very very safely, so you know the second dose you have to come on particular date you have to come. So not many additional precaution, except a lot of people ask me as a rheumatologist that, doctor, I was taking treatment for arthritis like methotrexate or some other drug, what should I do? So there are some standard guidelines which have already come, that basically most of the drugs are safe even if you take, because most of the people think that maybe the vaccine efficacy may go down if I take this drug. So most of the drugs are safe, as well as my own specialty rheumatology is concerned. But there are some drugs like biologics, we do tell them that especially if you are taking a drug like rituximab, probably that you should not take, and you should have a gap about 3 months, because that definitely reduces the antibody formation. And if you're taking methotrexate, you stop 1 week. So 1 week is good enough. Otherwise, other drugs like hydroxychloroquine or sulfasalazine, you can continue. So not very specific. If you take vaccine, and after the vaccine, probably the only thing you have to remember that you might get little fever or something. And secondly, that you have to come and you have to read, you have to note down which vaccine you have taken, because you have to go to the center so that the center has the same vaccine. Otherwise, if you go to other center, if somebody doesn't have the same vaccine, probably you'll be returned. So I think these are which comes in my mind. I think there are no specifics after the vaccine.
Crucial. That's important that the people need to take in mind and keep that in mind. Dr. Parvez, I want to ask you, several people now going in for the vaccine, the question they ask is, what are the likely side effects that they need to keep in mind that they could possibly have after the vaccine? As some of the doctors are telling us, it could be a slight fever, it could be some headache, but that is all that could possibly be happening.
In fact, the side effects have been actually statistically classified as those who are very common, uncommon, rare, and very rare, depending upon the incidence in the population. I feel the common side effects are, one is, as I said earlier, at the site of the injection, where you can have some soreness there, you can have bruising there, you can have a little redness or some pain there, which of course will go away. Some patients can get body ache, they may get joint pain, they may get some sort of a lethargy or weakness. This also goes away. There are few side effects like pain in abdomen. Some people get dizziness or giddiness. Some people may get mild degree of nausea, but they are fairly uncommon. One effect that I would mention, maybe that is more for a medical crowd rather than for your TV, but it's what has been called as the thromboembolism after vaccination. And that has been a crucial issue. There has been a lot of, I'm sure people read about it in the newspaper also, that there is a high chance of embolism or getting blood clots, in circulation because of vaccination. Now, there has been a good study done, which was basically coming from Poland, but it was reported by the European Medical Association, and they reported that there were about till, I think, March end, they had reported about 30 cases who developed various blood clots in the veins, in the system in the body which carry the impure blood. But the incidence was supposed to be about 30 cases reported in about 5 million jabs they were given. And it has been concluded that this is not more than what a general population would get otherwise. So the risk of thromboembolism to be counted, but as on today, the guidelines are, it is negligible as compared to the benefits, and there should be no problem so far as people taking vaccination. I feel most important thing for me is to make people aware that if you want to get out of this pandemic, you need to vaccinate. There is no doubt about that. And of course, the precautions after vaccination has already been mentioned. Keep hand washing, keep mask on, keep social distancing. And very important is the cough and the sneezing behavior. If you're coughing, cover your mouth. If you're sneezing, cover your nose. These are few precautions which are necessary. But vaccine is safe to take. I think is the only way out of this pandemic. I'm sure other panelists will agree with me.
Yes, and viewers, as we go through the show, we're also going to be discussing the other things that have come forward today. Like the Supreme Court has also said, there will be a national task force that will be looking into cryogenic tankers, supply of oxygen to all the states. But before that, all your vaccine questions that I'm going to get answered by our esteemed panelists here. Dr. Wali, another question that has come in here. Does the revised gap between Covishield jabs hold good for all the age groups, sir?
Well, yes, previously it was fixed depending upon the studies which were limited. Now they had found out actually during the studies they were supposed to specify the production of the antibodies. This Covishield people did not have much data in the initial phase, and information was coming that the data was inadequate, then the data started coming, and then they saw that antibody level is better if you wait for more than 2 to 3 weeks extra. So they have added that at time, and this is better because you allow the booster to work on the increased level of antibody, and it will be like a great summation effect. It's all summing up. You see, in many phenomena in the human body, there is a summation effect. So this summation effect in the antibody titer has been utilized, and therefore the duration was modified. It is also a good thing for those who are having vaccination centers. It is also good to reduce the crowds, but reason is scientific only, and the scientific reason is the titers which were studied, they are maximum after 4 to 6 weeks. So that the time interval was increased. Very, very brilliant question. And we have to patiently wait. Some people say my antibodies will be diluted. No, better antibodies will be produced if you have increased interval between the first dose and second dose, and your body will get more time to produce the antibodies. And I personally had pain, and I still have some pain. So people like me would have time to recover from the pain and lots of other things which they have in mind. And the stock availability, as we are discussing now. And I would add here something, that each vaccine has different mode. But finally, mode is that all the vaccines have a spike protein against which they have antibodies. Some have virus, some have inert virus, some have inactivated virus, some have RNA. So all these are produced vaccines. 3 of them are available in India. And lately, this Sputnik has joined the team of the vaccines in India. And it is very good to have, but as was told, you have to carefully choose the vaccine. It's not that you have to have a mix-up in your body. So the antibody production, contrary to what I was talking previously, would be less. So we have to have the best antibodies, and same antibodies are produced after we suffer from COVID. Also, as you asked, from the plasma, but the best is by the vaccine. And we can get the antibody titer measured also these days. So there's not a big deal. It's a very good thing to know after your vaccination is complete and you get happier that we have adequate amount of antibody. It's a two types of tests. One is the strip test and other is the blood test, which is quantitative. So this is a very good thing that you should know antibodies successfully produced by the vaccine taken, because some people have come to me, they had no pain, nothing, no reaction, no fever, and they were doubtful, was the vaccine fine? I have no fever, no symptoms, no nausea, no allergy, nothing, no pain. So yes, if it is not painful, if it is not producing fever, the vaccine has gone in, it would have a definite antibody protection, so you should not have a negative impact. So it's always good to ask your doctor what to do next after your vaccination is complete.
That's an extremely positive thing to say, Dr. Wali, because a lot of people do have had this question, Dr. Mahajan, which I had asked you on a previous show also, when they said whether we should go in for an antibody test just because we are feeling we're completely fine. But this is good news. If you don't have symptoms, even then you've been vaccinated, you are fine, and antibodies have been developed in your body. Dr. Mahajan, I also want to ask you here, what is the data, or possibly what could the data be on COVID infection that is there post-vaccination?
That's a great question. And before I answer that, I think we need to realize, as has been said by the previous panelists as well, that vaccination is a great thing. Vaccination prevents, to a certain extent, you getting infected. But still, the efficacy of the vaccines is limited, maybe 70%, 80%. So there would be that chance, residual chance of getting infection. So it's very, very important, despite your having had full vaccination, which, reaches the best possible level 2 weeks after the second jab, to follow COVID-appropriate behavior just as you were following before. The mask has to be worn at all times. Don't think that I've got vaccinated now and I don't need to wear the mask. This was actually misinformation which was there in the beginning, not only in this country, but in other parts of the world. So it is that the vaccine hasn't done away with your mask or with washing hands or maintaining social distance. You still have to maintain that. Where the vaccine is useful and it kicks in is that we've had a significant number of people who were fully vaccinated, had good immune response, and then got infected. Many healthcare workers have got infected. And what we saw in the majority of them was that it was a very mild infection that they had. It was either asymptomatic or mild infection. And only a very few of them, about 5%, needed to be admitted. And this is also similar to the data that has come out of the US, where they found that only 7% of those who had the jab and got COVID required admission into a hospital, and hardly anyone died. So the take-home point for your viewers is that you must get the vaccination, but you have to differentiate between infection and disease. You may get infected if you're careless, but even if you get the infection, and healthcare workers unfortunately have to work in COVID environments, and despite taking all precautions, they may still get infected. But if you get infected after having full immunization, you will, in all likelihood, have very, very little or mild disease.
Very positive, and that is something, therefore this is the reason, viewers, we all need to go in for vaccines, something all our guests have been speaking about, and Dr. Soin has also spoken about the need to hurry up and have the vaccinations on a fast track mode. Dr. Soin, therefore 2 questions here. Like Dr. Mahajan has been telling us, this is extremely crucial and valid to ensure that once we get vaccinated, it has to be done in the right manner. How to prevent COVID in children who are below the age of 10? And also, like you said, we gear up for a third wave. India needs to keep breathing. Dr. Mahajan also mentioned the healthcare workers who could possibly get infected. What is it that the healthcare workers also here need to keep in mind to ensure their own safety?
Very good questions. Well, first of all, protecting the young. Protecting the young from COVID is very similar to protecting people of any age. That means adults. So if you're dealing with very small children, then obviously you are the one who has to take the precaution. You have to mask up. You have to make sure that you're observing hand hygiene. But if they're older children, older than 5 or 6 years of age, then they have to do exactly the same thing that all the adults are doing, that we have been advocating for everyone. That means COVID-appropriate behavior, social distancing, hygiene, and masking. You can't mask very young children because, that could be dangerous. So you have to be careful. They have to understand what they have to do. And generally, it is recommended to mask children only older than 8. Even in schools, they don't recommend that. So protecting the young is basically, if they're very young, you have to be careful. And if they're older children, the precautions are exactly the same, right? Now let's talk about the second wave, the third wave, a possible fourth wave, what's been happening all across the world, what we expect in India, and where does the vaccination drive come? We are seeing a huge second wave. Now, going by the experience of the US, UK, France, Spain, Italy, Germany, we are going to get the third wave, perhaps the fourth wave, like Spain has had clear 4 waves, okay? So how do these waves happen? Each time the infection subsides when the exposure on the exposed population goes beyond 60-70%, and then a new set of population gets exposed and there is another wave. So obviously, in our first wave, we had a certain number. Now in the second wave, we have 4 times the number, but the younger people have only just started getting vaccinated and children will not be vaccinated. The rural population has largely escaped the first and the second wave maybe until 10 days ago. But now we're hearing reports of rural people getting affected as well. So the new populations that are going to be exposed are the rural population and the younger lot. And that's what's going to get the third wave in. Now, before the third wave happens, we probably have about 3 to 6 months going by the experience of other countries. And in these 3 to 6 months, we have to ramp up the vaccination drive enough to vaccinate at least 80 crore people, and all of them will be adults because there isn't data on children yet. It's only just started getting approved for children in the West. So 80 crore adults must get vaccinated, some with 1 dose, some with 2 doses. A total of 100 crore doses must be given in the next 5 or 6 months. That's how much you need to ramp up if you want to be a UK or an Israel, and to an extent, US, who have all done 2 things to curb the third and possibly a fourth wave. They've done selective or complete lockdowns, and they have ramped up their vaccination drive. The lockdowns are already happening regionally in India. We need to ramp up the vaccination drive. Now, where will all these vaccines come from? We have to ramp up the domestic manufacturing capacity. We have to import as much as we can, and we have to use the unused stock domestically, internationally, and in the pipeline. It'll cost a lot of money, but I'm sure the cost will be less than losing millions of lives and an irreparably broken economy. So those are the 2 takeaways from the third wave, possible third wave, and vaccination. Use the time between now and the third wave to vaccinate India.
Very important. Very, very important, Dr. Chaturvedi, and we also, Dr. Soin, I beg your pardon, very crucial, Dr. Soin, what you're saying, because viewers, we therefore need to learn, like Dr. Soin has said, from the model from US, from Spain, from UK, and vaccination overdrive is the need of the hour. That's also the reason why we've seen today the Supreme Court come out, a national task force, a 12-member task force has also been formed, which will take into consideration if there is anything that needs to be done, like Dr. Soin mentioned, if there is a third wave, any future emergencies is one of the lines written in that Supreme Court order that we read today, which is also something we'll be discussing. I want to also ask Dr. Chaturvedi. Dr. Chaturvedi, when do you think can the younger population be vaccinated? Because a lot of anxious parents are asking us this, and like what Dr. Soin just said, how does India take care of a third wave? And also a lot of people asking about the rural population. How do we get them vaccinated?
Look, whether you talk about,
as the scientific advisor to the Prime Minister was talking about third wave, all scientific community we were talking about the second wave, but frankly speaking, nobody knew that it will be so furious, and probably we were not prepared. So probably it's a preparation for the subsequent waves, whether you call it third wave or fourth wave, because it has happened most of the time. The pandemic, the very fact it is called pandemic, it is behaving exactly same what it was behaving earlier, whether in China or US or Italy, exactly it is behaving in the similar way. So the whole thing we have to follow in the similar way. Probably since cases were going down, there were hardly 200 cases per day. So we were not prepared. So that's why people thought that the corona has gone. So we were hopeful, but then we realized, yes, it is exactly behaving as it was behaving earlier. And as we predict now that from western, it is moving gradually toward the eastern side. You have seen now in Bengal, it is exactly going to happen in Assam, Nagaland, Mizoram, and other countries which we feel probably that is Singapore and Australia. That is going to happen exactly like this, which we can predict. And we feel in our country probably our issue is people who are not vaccinated. If people are vaccinated, we have a weapon. So who are not vaccinated? The vaccinated are children. So if children are not vaccinated, so that's why people are talking about third wave, that if a third wave happens, it is the younger generation, younger population which will be involved. Why? Because they will not be vaccinated. If they are vaccinated, they will be also protected. So probably we should have a drive to protect, first thing, those 18 to 45, which probably hopefully in next 5-6 months. And we should concentrate on those states where we fear that third wave, probably it will again start from the western side. So that is what I feel, that probably we must choose those areas, especially metros, where it will be more cases. So we must protect our younger generation. By the time trials will be available in India also, I am very sure trials for the children, and it is already there with the RNA vaccine. With these vaccines, which is against the spike protein, if we do a trial for the children, and these trials are already happening, then we can vaccinate children also, if we can protect our younger population. And probably it is the same thing happening in the rural population. What is happening in rural population is very strange thing, because in first wave when it came, probably because of the very strict lockdown, I can say the one single achievement in the first wave was a very complete lockdown by the Prime Minister, so that we didn't have many cases in the rural area. So rural area people thought this is this disease is only for the urban population. But we are hearing a lot of our relatives phone and the TV media report that it has already reached to the rural area. So first thing, the education. I am very sure this media does a very good job. So that media also, first thing is the education of the rural population, that whether it's a rural or urban, probably the effect will be same. So that is number one. Same precautions they have to follow, because otherwise what was happening, probably they was feeling that probably it's a disease of the elites. So it will happen, but it is people. There are reports in the media that we are losing people which I release a video that I always feel that, look, PCR test is done in the urban areas. In rural areas, either the facilities are not there, or people are not very knowledgeable, or the stigma at a test, so he doesn't go for the test. And those doctors, if they can have we should have a 2 ICD code. One is a One is those are PCR positive, and there is another, as we used to do for malaria in the army, we used to call it clinical malaria. So we should call it clinical COVID. If there are 90 people died in one village of fever and typical symptom of corona, but the PCR test was not done because facility is not available. So it is exactly what we used to call it clinical malaria. We were posted in far-flung areas like Nagaland, Mizoram, where we used to have endemic malaria, and we used to call it clinical malaria, and it was documented like this. So probably we have to, first thing, so that we have a data. Otherwise, what will happen during third and fourth wave, we always feel that we had only 4 lakhs cases per day. You never know, we may be having 8 lakhs cases per day. So if we want to plan about the next wave, we must have a good data about those patients also who are PCR negative. So that we should call it, that is what I have requested the government, that we must have a category, a separate ICD code, where we should call it a clinical COVID or clinical COVID, so that we have 2 categories. As well as the vaccination of the rural areas is concerned, I am very sure they are very enthusiastic. How we can do it, I am very sure this country had a very old history of vaccination. It's not only COVID. We have been vaccinating children, 30 crore children in the rural areas also. And I am very sure once our villagers are convinced, now they are convinced, they will come forward themselves. And that is the only way of protection. One is by education, another is by vaccination.
And I have to mention, Dr. Chaturvedi, I really appreciate at a time when hope is what India has, and hope is what all the doctors are speaking in the language of this is the way forward, because it's with hope, with a lot of good sense, there are a lot of common sense that India needs to fight this battle. Dr. Balve, I also ask you, anxious parents, grandparents, and a lot of people are asking us, what are the medicines that can be given to children for immunity boosting? And also taking off from where Dr. Chaturvedi said, the rural areas also needs to be very crucially looked at for vaccination. What are the kind of details that need to be supplied at such a time? What is the kind of infrastructure that needs to be there to ensure this can happen quickly? Because like Dr. Soin mentioned some time ago, we need to really ramp up vaccination.
In fact, for vaccination, one important thing that I would like to mention is we must ensure that everybody gets the 2 jabs. Otherwise, we are going to give the first shot and then there is no vaccine available for the second shot, which is not going to work. Second important thing is they are also planning to put Sputnik, Now, Sputnik has got 2 different types of vaccines which are sequentially followed at an interval of 3 weeks. The 2 vectors are different. So if you want to have complete Sputnik vaccination, you must get the 2 jabs also. And so far as the Covishield or Covaxin is concerned, we must ensure that the population gets 2 shots. Otherwise, you give 1 shot and second shot is not given, it is not going to work. I feel our polio vaccination has definitely set some sort of a trend in the world. We have become a polio-free country. And that is a disease which happened in urban as well as rural population. We had Anganwadi workers or the fantastic schemes of the central government which made sure that the polio vaccine reached to the poorest of the poor person or the remotest place in India. I feel the same precautions need to be taken. And one good plus point is our vaccines which are available can be stored between 2 to 8 degrees centigrade. So it is not impossible to transfer or transport these vaccines to the remote areas also. Education of the people, understanding that vaccination is the only way out of this particular solution is, I think, very important. So as somebody earlier said, education of people, and that's where the media is going to play an important role, Make sure that you convey to the people that please take vaccine, For some superstition or for some false information coming on WhatsApp groups, don't shy away from vaccination. Take not only one, make sure that you take your second shot in time, and through government machinery, I am sure the governments are capable of getting the vaccine to the poorest of the lot in the remotest area of the corner of the India.
Yes, very positive and very crucial, because that is the need of the hour. Whether it's the vaccines that go to the southern states, the northern states, the western or the eastern states, that is the need of the hour for everyone to be vaccinated. Dr. Wali, 2 questions. What supplements should the elders be taking? for immunity, and similarly for the children, what should they be taking before they can get vaccinated or a vaccine opens up for the children as well?
Yes, as regards our babies, it will take a little longer. But for the children of very young age and their immunity boosting, see, mother's feed is most important. When the mother is feeding a baby for a sufficient length of time, in our days, the ladies used to feed for 2 years like that. But if the baby has got minimum 6 months feeding, mother's milk would provide all the basic immunity to fight all kinds of calamities which the baby could face. In the rural areas, babies are exposed to a lot of atmospheric insults and they develop and acquire immunity, which we were talking in the last part of the pandemic. But the personal hygiene and the mothers feeding babies nowadays are required to wear the mask, and they should maintain adequate hygiene, and people should not handle children like they used to handle, like frequent taking in the laps, hugging, kissing. These all activities should be minimized. And we have to be very careful because children have different kind of symptoms, children have different kind of presentation, and which is sometimes very difficult to identify. This is one of the very important point when we deal with smaller children, and also their symptoms are vague. Any symptom in a child, starting from fever to abdominal discomfort, which the child is hardly able to describe, unexplained vomiting, unexplained failure to take or thrive, failure to take feed or failure to take food, vomiting, and all these symptoms combined. You see, we have lot more work done on the children area, and like in adults, we have multi-organ dysfunction syndrome. We also have multi-organ involvement, especially pancreas and liver, and this has been added symptom in the children. Identified. Dr. Soin must be dealing with some cases like this because he's our honorable liver transplant surgeon. And I thank Republic TV for bringing such a researched presentation, and I thank Dr. Jan for adding to my answer. And we came here, I come here actually much to learn from your channel, and same is for the viewers. And this third wave preparation is most important. While thanking Republic TV for their endeavors on this side, I would remind everyone that go for vaccination, wear mask, practice COVID-related hygiene, which we call COVID-appropriate behavior, and please do not go out. And I would finish with a lighter note that this virus is very proudly and very selfish and very heavy-headed. Unless you go out and invite this virus will not get into your homes. So stay at homes, as I initially said, lockdown at your feet, lockdown at your face, and all categories will be vaccinated in the days to come. Please wait. Our officers, our ministry, and our administration is very, very alert and awake that how to fight the third wave. And the best solution to fight the third wave is that whatever facilities we create now for the second wave under this heading of second wave, we should not wind them up. We should continue them and not pack them back, as has happened in the previous part of pandemic. And if we do that, we will have a great loss. So we have to increase in an upgoing graph rather than downscaling it or winding them up. So we have to add, and we have to add pediatric ICUs, very important message, pediatric ICUs, neonatal ICUs, and pediatric technicians, pediatric doctors, or staff, nurses especially, to handle children, because the management of the pediatric and adult population is entirely different. And similarly, identification of this syndrome of COVID is also very difficult. So we have to be very alert. And as our Prime Minister has repeatedly said, Savdhani hati durghatna hui, this would imply till the last. And we should be very, very sincere in our efforts from our hearts that we will utilize our country's resources to the maximum. And everybody is a COVID warrior. I would say everybody is COVID warrior. Everybody can add to something. and stay home. That's my message. And please wear mask. All of us have agreed on this unanimously, and this should be the message of this program, that whatever administrative job is that the government is doing, DRDO is doing, Army is doing, and everybody is doing. The foreign countries are keeping a close watch on our country, and they would be helping us. And one thing more I would say, that there are some unfavorable articles coming about the vaccines. That there are some countries who have stored large amount of vaccines as a surplus. They should come out and offer to countries like India. And whenever we have increased utilization, or I would not say shortage, I will say positively, increased utilization, those countries should give us vaccine on loan, and we can compensate their stores and replenish their stores. So it is a global fight, and I would say with a global perspective, that join hands together and fight the COVID. All of us are part of it, a part of this fight, and all of us have to fight the COVID, and then only we will have success.
Absolutely. That's a very positive note. And Dr. Wali, I thank you. I thank Dr. Mahajan, Dr. Arvinder Soin, Dr. Ved Chaturvedi, Dr. Jayant Barve, and well as, like I said, Dr. Wali, for these very wise words. I have to say one thing when we end this, nothing is going to be permanent, viewers. Even this difficult phase that's going to pass, and this difficult phase will be passing. Like all the doctors have said, it's important to get vaccinated. Our forces are completely with us. They are helping us. They are ensuring that everyone gets vaccinated. People who need a hospital bed or oxygen or cryogenic tankers, that's also reaching them. This is not a time to only be looking at gloom. It's also a time to understand that the difficult phase will be passing, and also, most importantly, like all the doctors are talking in unity, it is time to get vaccinated. I thank our frontline warriors, our doctors, for taking our precious time, for giving us a very positive note, whether it's talking about the infrastructure, whether it's talking about the third wave, or whether, most importantly, it's talking about the way ahead. Thank you for being with us on Republic TV. I thank all of you.
Thank you.
Thank you, viewers also.